The following is a brief demonstration on the instructions for use and the science behind Socket Graft Injectable. This product has been cleared by the FDA and contains no human or animal products. Socket Graft Injectable is a high-viscosity putty intended to be used when all 4 bony walls remain intact after extractions. Because the material thaws in only 5 minutes, it should be kept frozen until the patient is seated. In the event of an unpredictable extraction, such as a missing wall, Socket Graft Injectable can be refrozen provided the pouch has not been opened. In the case of a missing wall, use an alternative bone graft, such as Socket Graft Plus, to repair a dehiscence. After the tooth has been extracted, make sure to debride the socket. Any debris left in the socket will compromise the material. If heavy bleeding occurs, place a sterile 2x2 gauze wetted with lidocaine to control blood flow. Unlike many bone grafts on the market, Socket Graft Injectable does not require the presence of blood. Our regenerative material specifically targets the bone-producing cells that live in bone. After the blood has been controlled, insert the dispensing tip into the apex and inject the graft material until the gingival margin has been reached. Slightly overfill the socket. Use an instrument of choice to compress the graft material. This will fill all the voids in the socket. Unlike other problematic graft materials, Socket Graft Injectable does not require packing, therefore saving you time. After grafting, cover the material with a dense PTFE membrane. Do not use animal or human membranes as they will compromise the results of this material. Remove the membrane after 1 month, exposing the soft connective tissue of mineralizing bone. The following section will explain just how our material works in the bone. Socket Graft Injectable, as well as our other regenerative products, works by stimulating bone regeneration, or osteogenesis, in the patient's bone. When our bone graft is placed, the calcium phosphate in our material works as a matrix for osteoblasts to crawl onto. Osteoblasts are the cells in our bodies responsible for bone formation. The osteoblast cells absorb our proprietary organic compound, SL factor, through the cell membrane. After processing SL factor, the osteoblasts begin secreting osteoid, which is the unmineralized organic substance that forms prior to the maturation of bone tissue. The osteoid encases the osteoblasts within the matrix before mineralizing. Once matured, they become permanent bone cells. The graft material is completely resorbed, and the patient's bone is regenerated into healthy, vital tissue. Because the osteoblasts are proliferating and secreting osteoid as soon as 4 weeks, early implant placement is not only possible, but ideal for achieving optimal bone-to-implant integration. The reason for the success of the early implant technique is due to high numbers of stimulated osteoblasts found at 4 weeks. The primary source of osteoblasts is at the apex of the socket, which is why bone mineralizes from the apex to the crest. When an implant is placed in mature bone, there are very few active osteoblasts that would therefore need to be stimulated. Bone at the implant interface would need to be remodeled before integration can occur. Mineralization at 4 weeks does not occur in non-grafted extraction sites, nor in cadaver bone grafted sites. If you are new to this product, we suggest you wait 12 weeks for implant placement. This will allow you to gain experience with the material before trying early implant placement. Thank you for watching. Please feel free to contact us for further information on this product, as well as to learn about our special technique for sutureless membranes, as well as information on a product mentioned earlier in the video, Socket Graft Plus.